As lawmakers in our nation's capital continue to debate health care, Minnesota's newly formed Select Committee on Healthcare Consumer Access and Affordability has begun meeting. Joining me in the studio is the chair of this new Select Committee, Senator Scott Jensen. Welcome.
Thank you, Shannon. Appreciate it.
The healthcare conversation lately has become largely about premium, prices, and insurance coverage, and less about actually caring for health. In fact, many people spend more time talking to insurance companies than to their doctors. So how do we fix this? How do we change this?
We have to change the narrative. We have to focus on cost. When a person goes to a grocery store, they've got a certain number of items and each item has a price. You add all those up, that's the cost. That's the cost of healthcare in the state of Minnesota, the cost of healthcare in the United States. So 5% of the gross domestic product in the early 1970s was devoted to healthcare. Now we're closing in on 20%. Why is that? It's because of cost. We do more things, and those things have higher ticket items, higher prices, if you will. That's where the focus has to be. We need to talk about cost.
Now, some people say that some procedures cost more in one place than another place, and depends on your insurance and which insurance and how it's paid for. Should there be a standard price for everything?
A loaf of bread at Byerly's might cost more than a loaf of bread at a Cub food store. So I can understand some differences in price, especially in terms of hospitals that have greater needs in terms of providing services across the board. But in the world of primary care, I don't see a reason why we can't have a uniform set of costs. It's difficult to break into the world of healthcare. So in the same way that we have public utility agencies to help determine costs, I think it would be reasonable to do the same thing in terms of physician costs. If we did that, then we could get to true transparency so the consumer would know what they're going to pay. If you asked me at my clinic to post our top 10 items that we do for patients, we have 10, 15 different fee schedules. Which one should I post?
That's complicated. During the last session, the legislature initiated a state reinsurance program to help insurance companies who are covering really high cost individuals. Was this a Band-Aid, or is this part of the solution going forward in terms of how we're paying for healthcare?
I think it's both. I think it's a Band-Aid in the sense that if you're bleeding, the first thing you got to do is stop the bleeding, so put a Band-Aid on it. And that's what we needed to do. So I think the whole issue of premium rebates and reinsurance was part of that. But it's also a solution going forward, because if you look back to when Minnesota was a leader in healthcare, we had one of the lower numbers or percentages of uninsured. We had MCHA to take care of that high-risk pool of people. If you go back to then, we had something like that. We had a reinsurance mechanism. That's what we put in place again. That sets the stage for us to do the next thing, which is to focus on cost.
Well, and so you bring up how Minnesota used to be a leader in healthcare. We used to be on the front edge of how we treated people and how we paid for healthcare. That has changed. Can Minnesota take that leadership role again? Do we have the expertise? Should states be more in control of healthcare as opposed to the federal government? Where do you come in on that?
The first question, can we lead once again? If we don't, we will have failed. We have people like Michelle Benson, Tony Loehrke, Jim Abler, Paul Gazelka. We've got 2 physicians in the Senate. We've got Matt Dean in the House. We've got people passionate about improving health care. We can lead again, and that has to be our goal. I think we can.
Should it be left up more to the states instead of federal? I mean, how much of a role should Minnesota policymakers be taking in determining how healthcare is delivered in the state of Minnesota?
If you look back, when Minnesota was a leader, other states looked at what we were doing to see what they might do. You have to allow that to happen. The federal program can't be as tailored and coordinated to our needs. So I think absolutely the states should be allowed to lead. They should be allowed to slice and dice. What do our folks need? What's going to work best in our part of the world? So I think absolutely.
What do you hope for in terms of outcomes with the Select Committee?
I hope that we provide the basic ingredients for a robust piece of legislation that will be presented to the legislature next March in 2018. It'll first go hopefully to the Health and Human Services Committee to be reviewed and analyzed and discussed further. But I want to talk about things like transparency, consumer tools. I want to talk about drug costs. I want to talk about essential health benefits. These are the things that we need to really dig down deep into the weeds. And that's what Senator Gazelka asked us to do.
You mentioned earlier lowering everyone's health care costs. Is it still true today that the more people that are covered by insurance, the lower the health care cost? What is the role of insurance?
I don't think that that really is true. I think when someone says, gee, if we insure everybody, will the cost of our health care go down? No, I think basically it'll go up because more use will take place. If you look at 1965, when we put Medicare and medical assistance into place, no question, appetite for services went up. There's been an inflation of both number of procedures and along with that cost. So I don't think we should delude ourselves. Costs will go up. What we need to do is, as a nation, as a state, as a legislature, we need to decide what can we afford. And then we need to talk to all Minnesotans, all United States citizens, say, you need to be a part of the solution. This is not a we-they proposition. This is not a Republican-Democrat issue. This is about our country.
Does a cap become part of the conversation in terms of how much the state or the federal government will pay in terms of covering people's health care costs?
When we get back to how to pay for it, then I think we divert from the role of this committee. This committee really needs to stay focused on costs. How do we reduce imaging costs, drug costs, things like that. But in terms of what the feds are talking about in terms of capping, that's a work in progress, and they're talking about this option, that option, and the other. I'd prefer to sort of stay focused on what we need to do right now.
One last question for you. How does the rising cost of prescription drugs fit into this whole picture?
If you actually look at the pie of healthcare costs right now, one of the most rapidly expanding chunks of that pie is pharmaceutical costs. There's stories all over the place about how ridiculous things are in terms of cost. I had one patient who was paying $70 per pill in this country, but then when he chose to reach out to a Canadian online pharmacy, that cost went from 70 down to 7. We've got stories about doxycycline tablets going from $0.25 a tablet to almost $50 a tablet in some situations. Somehow we're going to have to address this issue.
Senator Jensen, I want to thank you so much for your time today and good luck with your select committee.
Thank you very much. I appreciate it.